The National Infection Prevention and Control Manual. This short video will provide an overview of the National Infection Prevention and Control Manual, including what it is, who it is for, and what it contains. After watching this video, you will be able to navigate the content and understand how it can be applied in practice. What is the National Infection Prevention and Control Manual? The National Infection Prevention and Control Manual was published in 2012. Developed by RHI Scotland, it is an evidence-based manual for use across Scotland, aiming to reduce the risk of healthcare-associated infection and ensure the safety of those in the care environment, including those being cared for, staff and visitors. It also aims to make it easy for care staff to apply effective infection prevention and control precautions, reduce variation, promote standardisation, and optimise infection prevention and control practices throughout Scotland, and help align practice, monitoring, quality improvement and scrutiny. RHI Scotland ensure that the manual remains evidence-based, or where evidence is lacking, the content is based on the consensus of expert opinion. This is maintained by continuous engagement with key stakeholders across Scotland and a national team of infection prevention and control specialists and healthcare scientists within RHI Scotland, reviewing scientific evidence and undertaking critical appraisal. Any major changes identified in the scientific literature may lead to a change being made to the manual. Who is the National Infection Prevention and Control Manual for? This Infection Prevention and Control Manual is for all health and care staff across Scotland and contains infection prevention and control guidance and supporting tools. A specific care home manual is tailored for health and care workers within these settings. The manual is endorsed by the Chief Nursing Officer for use in NHS Scotland and adult care homes. In all other care settings, to support with health and social care integration, the content of this manual is considered best practice. What does the manual contain? The manual currently contains 4 chapters. Chapter 1. Standard Infection Control Precautions, commonly referred to as SIPs. Chapter 2. Transmission-Based Precautions, also known as TBPs. Chapter 3. Healthcare Infection Incidents, Outbreaks and Data Exceedance. And Chapter 4. Infection Control in the Built Environment and Decontamination. There is also an addendum for infection prevention and control within neonatal settings. In order to support care homes successfully adopt and implement the National Manual, a context-specific care home infection prevention and control manual was co-produced in 2021 with national and local stakeholders. The content of the care home manual is completely aligned to the evidence-based National Manual. The homepage of the main manual contains latest news and updates, so ensure you visit this regularly to see what's new. Chapter 1 covers Standard Infection Control Precautions, or SIPs, which are to be used by all staff in all care settings at all times for all individuals, whether infection is known to be present or not, to ensure the safety of those being cared for, staff and visitors in the care environment. SIPs are the basic infection prevention and control measures necessary to reduce the risk of transmission of infectious agents from both recognised and unrecognised sources of infection. SIPs may be insufficient to prevent cross-transmission of specific infectious agents. Therefore, additional transmission-based precautions, TBPs, are required to be used by staff when caring for patients with a known or suspected infection or colonisation. Chapter 2 covers TBPs, which are categorised by the route of transmission of infectious agents. The application of TBPs may differ, depending on the setting and the known or suspected infectious agent. Chapter 3 aims to support the early recognition of potential infection incidents, detailing definitions for a healthcare outbreak, incident or data exceedance. It also provides a guide for infection prevention and control or health protection teams to the incident management process within care settings. Chapter 4 is currently under development and exists as a repository for evidence reviews and tools relating to infection prevention and control in the built environment, including delivery of appropriate decontamination within health and care settings and risk mitigation for water-based pathogens. The neonatal addendum supports neonatal units by providing IPC guidance specific to this setting in addition to each chapter of the manual. To support the chapters and neonatal addendum, the manual contains a series of appendices that include hand hygiene posters, aid memoirs, and various tools and templates to aid application of IPC measures in practice. The manual also contains an A to Z directory of pathogens. This provides a description of the pathogen, incubation period, and infectivity, along with transmission routes, notifiable status, and alert organisms for diseases associated with the pathogen. There is a resources section within the manual, which contains leaflets, quality improvement tools, and a variety of other useful items to support application of IPC precautions in health and care settings. The resources can be used as supporting tools where required. For further information, please visit the National Infection Prevention and Control Manual website, www.nipcm.scot.nhs.uk. This can also be accessed on mobile devices. If you have any feedback or inquiries relating to the National Infection Prevention and Control Manual, you can submit these via the Contact Us tab on the main landing page. For general infection prevention and control inquiries, you can also contact your local Infection Prevention and Control or Health Protection team or RHI Scotland.